Hello, my name is Lillian Cook, and I will be completing my presentation over atherosclerosis. So, atherosclerosis is a cardiovascular disease. According to our textbook, it is defined as a chronic and progressive disease of medium to large arteries. While it is a cardiovascular disease, it impacts arteries all throughout the body. These include thoracic, femoral, popliteal, and cerebral arteries, along with the carotids and abdominal aorta. Notably, atherosclerosis can impact the coronary arteries within the heart. This leads to coronary artery disease, which is the #1 cause of death in America. In this image provided by the Texas Heart Institute, you can see the coronary arteries and the aorta. The aorta is important because it is the main blood supplier to the body. So, what exactly is atherosclerosis? It is a specific form of arteriosclerosis, where plaque builds up in the walls of vessels. This narrows the vessels and decreases blood flow, further decreasing the oxygenation of tissues and their supply of nutrients. The name atherosclerosis can be broken down into ather, which means porridge, and sclerosis, which means hardening. Furthermore, in order to understand this disease, it is important to consider the anatomy and physiology of arteries and vessels. Vessels typically consist of 3 layers. From deep to more superficial, they consist of the tunica intima, tunica media, and tunica adventitia. The lumen, of course, is the hollow part where the blood flows. And then I made this little visual of a vessel just so you can see the different layers. So this is the inner layer. This would be the intima, and it is simple squamous epithelium. And then next we have the media, which is smooth muscle cells and connective tissue. And then the outer region is the adventitia, and it's connective tissue. In between each of these, of course, would be elastic fibers, and then the middle would be the lumen. So the development of atherosclerosis will begin in the intima layer of the vessels. Of course, if it goes untreated, it can impact all 3 layers and many other tissues throughout the body. As blood flows through the lumen, substances in the blood begin to stick to the wall of the artery, forming the plaque. The plaque typically consists of fatty deposits, cholesterol, waste from cells, and calcium within the bloodstream. According to the American Heart Association, the degenerative nature of atherosclerosis progresses as follows. 1, a fatty streak develops by sticking onto the artery wall. 2, vulnerable plaque. This plaque develops with a fatty core and a thin fibrous outer shell. 3, stable plaque. This is when the plaque begins to thicken. 4, a plaque rupture. This is when the plaque ruptures into the bloodstream. 5, thrombosis. This is when there is clotting of blood at the rupture site. And then 5, occlusion. This is when the blood clot continues to enlarge and eventually blocks the artery. This is dangerous because it cuts off the oxygen and nutrients to the tissues. This image here is a good visual from the USA Vascular Centers showing how it begins as a fatty streak and continues to progress to plaque to a blockage. It is important to note that as it progresses, the artery walls thicken and stiffen. The progression of plaque buildup is what narrows the artery and lessens room for blood flow. This is dangerous in itself. When this happens in coronary arteries, it can lead to a heart attack or even heart failure. When it happens within cerebral arteries, it can lead to a stroke. So, what is the cause of atherosclerosis? Well, it is believed to be triggered by endothelial injury and associated with the gradual buildup of cells on artery walls. Endothelial injury is caused by physical stress on the artery walls. Stressors include hypertension, elevated cholesterol, triglycerides, type 2 diabetes, family history of heart disease, and smoking. Smoking is a major risk factor for the development of atherosclerosis, and specifically it is known to build up plaque within the aorta. As we know, lifestyle plays a major role in preventing this disease and diseases in general. Okay, now I'll discuss the primary, secondary, and tertiary prevention methods of atherosclerosis. So generally, primary prevention methods are going to be avoiding the onset of the disease. Secondary is going to be treatment of the disease in the beginning stages or at the onset. Tertiary is generally going to be management of chronic disease and improving someone's quality of life when they do have the disease. So primary prevention methods of atherosclerosis are typically going to revolve around a person's lifestyle. So some methods of prevention are going to be exercising. So a good rule is the 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity within a week, every week. Another way to avoid it is by maintaining healthy weight and a diet. So typically a healthy diet for avoidance is going to be one high in fiber, lots of fruits and vegetables, healthy fats, and then plenty of protein. Another good way to avoid this disease is by managing stress to the best of your ability. And then the major way that you can work to avoid this disease is by avoiding smoking. Because as we know, smoking has a direct impact on the aorta, which is the biggest vessel that we have in the human body. Secondary prevention methods for a person diagnosed with atherosclerosis can be put into place with the help of a healthcare provider. These are typically going to include medications that decrease the person's likelihood of developing a blood clot. One of these medications would be an antiplatelet medication such as clopidogrel. This medication decreases the risk of blood clots by decreasing the blood platelets' ability to stick together. Another medication would be aspirin, which thins the blood. Together, aspirin and antiplatelet medications are known as dual antiplatelet therapy or DAPT. Another medication that can be prescribed are anticoagulants, such as warfarin. These thin the blood, preventing blood clots. They work differently than antiplatelet medications but do a similar job. Lastly, another medication that can be prescribed would be statins, such as atorvastatin. These work to lower a person's cholesterol. Then lastly would be tertiary prevention methods, which would likely take place following a cardiac event such as a heart attack. Their purpose would be to help prevent cardiac events in the future. Generally, these methods will consist of some sort of revascularization procedure to restore blood flow. Coronary revascularization treats ischemia, which is damage due to a lack of blood flow in the vessels. Some examples would be percutaneous coronary intervention, which restores blood flow, and another one would be coronary artery bypass grafting, which actually creates a bypass around the blocked artery. In most cases, the beginning of atherosclerosis shows no symptoms. This is why it is important for a person to understand their own personal risk factors, such as their own medical history and the medical history of their family. However, symptoms of atherosclerosis are based upon the artery that they are affecting. Some signs to be aware of would include chest pain, heart palpitations, shortness of breath, weakness or tiredness, and of course, heart attack or stroke. For the last part of this video, I just wanted to include how I initially learned about atherosclerosis. I learned about atherosclerosis at work. I do work for an optometrist where we perform fundus photography. Fundus photography is a picture of a person's retina, and they can see the health of their eye and even their systemic health through this image. Because of the prevalence of hypertension and high cholesterol in America and even diabetes, we do see diabetic retinopathies, hypertensive retinopathies, and fatty deposits in retinas almost every day. We often say that the retina is the window to the inside of a person's body. This is because we can see so many of these disorders through fundus photography. For the purpose of this project, I will show a retinopathy that does have fatty deposits and where you can see the atherosclerosis, more specifically the plaque buildup. Here is a picture of a retina by Washington University in St. Louis School of Medicine showing how fatty deposits can spread all throughout one's retina. The fatty deposits are the yellow speckled dots all throughout the image. I just wanted to include that bit of information to emphasize that even though atherosclerosis is a cardiovascular disease, it can impact all parts of your body. This would be due to its ability to induce blood clots within the vessels. Thank you for watching my presentation on atherosclerosis. I hope that you learned something new. I will put my references at the end of this video and attach them in the discussion.